Welcome, my name is Peter Strong and I provide online mindfulness therapy for the treatment of anxiety and depression and addictions, but mostly people who come to me for help with anxiety disorders. This is by far the most common problem that most people struggle with. So if you're interested in mindfulness therapy for overcoming an anxiety disorder, do please reach out to me by email. Go to my website, learn more about mindfulness therapy and how it can help you overcome your anxiety disorder. So, anxiety disorders generally describe problems that are persistent, that are chronic in nature. It's not the short-term anxiety that we might experience, for example, giving a presentation or something like that, that we're concerned with. We're concerned with persistent, recurrent anxiety. So generalized anxiety disorder is one kind of very common anxiety that's characterized by chronic worrying, just catastrophizing, just basically a form of anxiety that's characterized by the proliferation of anxiety-based thoughts that just keep feeding that anxiety in a vicious circle. Social anxiety disorder is another anxiety disorder that I work with. It's also based on a whole network of habitual reactive thoughts and beliefs that feed a basic underlying insecurity in social situations. And it's very important to work with your anxiety disorder and not let it grow and gain strength, and because it tends to continue to grow if not checked. It's like a weed, and if you don't take care of it, it will start to limit you more and more. Because one of the key problems that people experience when they're suffering from an anxiety disorder is they start to get into patterns of avoidance and aversion, that is, trying to run away from the anxiety. They try to limit their exposure to anxiety-producing situations. They try to avoid the source. Now, this kind of limitation, this kind of self-limitation, is what really creates the problems, because it tends to grow, and it grows and grows the more that you persist with avoidance. So we have to really get on top of that. And the first rule of mindfulness therapy is to say absolutely no avoidance, no trying to escape your anxiety, no using breathing techniques, or trying to think positive thoughts, or trying to think about pleasant things. These are all forms of avoidance, and they will have only one effect, and that is to actually strengthen the underlying anxiety. The only effective method to overcome an anxiety disorder, like generalized anxiety disorder or social anxiety disorder or obsessive compulsive disorder as well, is by actually not avoiding it, but actually facing it very directly, very head on, but in a strategic way. Not just allowing yourself to become overwhelmed by the anxiety, but you have to learn how to develop a conscious relationship with your anxiety. That is what makes mindfulness therapy so effective and so special. So the anxiety is there. Avoiding it is not going to work. Choosing to face the anxiety directly and in a mindful way, establishing a relationship with the anxiety whereby you learn how to become less and less reactive and less overwhelmed by the anxiety. That is the key. That's the way forward. And that's what I would train you in doing during our online mindfulness therapy sessions. The primary way we go about this is by identifying our anxiety thoughts, the worry thoughts, the negative thoughts, the catastrophizing thoughts, whatever they may be. We identify them and make a list. Then we choose to meditate on each of those thoughts. So this is developing non-avoidance. This is developing that conscious relationship. We learn to see the anxiety-producing thought as an object in the mind, which is what it is, what it always was to begin with. We see it as an object that gets triggered in the mind and it arises in the mind, and our job is to see it clearly without identifying with it, without trying to push it away. So we develop a conscious relationship with it. It's as if we hold that thought in a space and we embrace it in that space, but without feeding it through reactivity. That is what produces change. And it can be very quick as well in producing changes and basically undoing that habit of reactive thinking that feeds the anxiety. So we deliberately meditate on our anxiety thoughts. We don't avoid them. The second part of mindfulness therapy involves looking at the structure of those thoughts. Besides the proliferation of reactive thinking around the anxiety, we also look at the actual structure, the internal structure of the anxiety itself, and that structure is in the form of imagery. So all emotions are based around imagery. That's what holds them together in the mind, gives them structure, and investigating that imagery is a very, very effective way of neutralizing the anxiety habit, the anxiety reactions to begin with. We need to change the imagery. Typically, the anxiety is too large in size. For example, that's part of its imagery, the size of the anxiety image. It's often too high. That's why we feel that it's overwhelming us, because it is literally hanging over our head. So its position is very, very important in determining its effect. The intensity of anxiety is proportional to the size of the anxiety imagery and its height. So these are two things that we work on changing. Imagery can be changed once we bring conscious, mindful attention to it. And when you change that imagery, you change the emotion. It's as simple as that. So I will teach you how to do that, how to work with the emotional imagery that is the structure of your anxiety or depression or any other intense emotion. So if you'd like to learn more about how to work with an anxiety disorder using mindfulness, please contact me and let's schedule a therapy session over Skype, and I will begin to teach you how to apply mindfulness to overcome your anxiety and return to a state of natural balance and well-being, which is really your natural state to begin with. Anxiety is not a natural state. It is an acquired state. It's something we learn through habitual reactivity and avoidance. So to learn more, simply email me, and to schedule a session, simply tell me what times and days work for you, and we can then go ahead and schedule the first therapy session. Most people see quite dramatic changes after that very first session, and certainly within 3 or 4 sessions you can expect to see major improvements and a major reduction in the level of anxiety that's affecting you. So please reach out to me by email and let's schedule an online mindfulness therapy session for your anxiety. Thank you.